How do you know if an end user is a good candidate for a grant? And then what do you need to know for that? Or what do those end users need to know? Do I qualify for this?
Yeah, no, that's a great question, and there's also a couple different types of grants that are out there. When we're talking about stimulus funds, traditional what we call annual grant programs, the biggest thing to look at is first, particularly for the audience here, as you go to look for customers that might benefit from this program and from this type of expertise and connecting the dots that we do. Obviously, the top recipients are public sector agencies. We've talked about state and local governments, K through 12 school districts, charter schools, institutions of higher education, public or not-for-profit healthcare providers. So, the biggest thing is identifying the right type of customer in that regard. But then when you actually get down to evaluating the customer itself, it's the big thing to find out is, do they have funding to pay for the project, right? So if they actually have a budget or have the funds on hand to obviously pay for these things, you don't want to necessarily introduce grants into the equation to slow the process down. Most of these stimulus funds require that you haven't budgeted for the items that you're looking for, that it was sort of a popped up or needed to be expanded network for telemedicine or for distance learning because of the pandemic. So, the big thing is finding out whether they already have a budget for it. And so for those folks that don't have a budget or only a partial budget, those are really the candidates to really look into in terms of moving forward. In terms of their needs, what purchases do they plan on making? Are they longer term purchases? Can they be considered emergency purchases as well? Can they be connected back to the pandemic, obviously, and the things that were necessary there? But first and foremost, is the right type of customer. Do they have a budget for the project? And grants office and our team here can flesh out really the rest of that equation in terms of what grants are out there for that particular customer. When we have the follow-up call, we can dive into why this might be a bit of a more low-hanging fruit for this customer, while this customer really needs to pursue these opportunities over here for one reason or another. So the other thing to look at are for projects that impact the constituency that agency serves. So if it's residents, students, patients, that's a big thing to look at as well. The closer we can bring the technology to impacting patients, distance learning for students, telemedicine for patients, for constituents, being able to connect with constituents in a particular locality or state, even when it comes to vaccine availability, distribution, all these type of things. So, but yeah, first and foremost, just making sure it's a sort of a public sector agency like we've discussed, and whether they have a budget for the project.
Yeah, telemedicine is huge. I mean, with COVID, for the first time, you heard health officials say, "Don't come to the hospital unless this is dire." And you have people at home who don't have internet connectivity, and they still need to receive healthcare for their standard. I have high blood pressure. I have heart disease. I have this. I have that. Those folks still needed to get treated, and it's good to see that these programs are out there for folks.